Hello everyone. This video is going to focus on the importance of addressing challenges of a caregiver. A caregiver is considered as an important team member in the patient's treatment. This is true right from a child to a geriatric patient with a communication disorder. Now let's look at some facts before we move on. The aspect of caregiving in India by the family members is unique as compared to other developed countries where caregiving is most often equivalent to formal or paid care. This particular study here gives an important insight into the need for caregiver support. Broadly, these are the difficulties faced by the family, and this could vary with different cultures, families, severity, and condition of the patient. The caregiver has to talk to the doctors or therapists, arrange for medications, look after the patient's meals, sometimes help them move, take care of the family's environment and financial loss, and also their own personal health in the middle of all of this. Informally, these factors must be assessed because the number of caregivers, their education, occupation, economic status, physical health, all of these will be playing a crucial role. Now, there are two scales available that can objectively assess the burden faced by these individuals. Not all caregivers will be needing a detailed assessment, but definitely those who are involved in caring for patients with stroke, dementia, Alzheimer's, or who require severe assistance. You can reach out to us for these two scales, Oberst Caregiving Burden Scale and Caregiver Strain Index. Caregiver training is a multidisciplinary approach and will be carried out by these professionals mentioned. Here you can find some useful caregiving tips. First is accept help. Tell the caregiver to be prepared with a list of ways and accept help from others. It could be a friend, a relative, or anybody. And let the helper choose what he or she would like to do for them. Focus on what they are able to provide. Tell them it's normal to feel guilty sometimes, but understand that no one is a perfect caregiver. Believe that they are doing the best they can and making the best decisions they can. Get connected. Find out about the caregiving resources in their community. Many communities have classes specifically about the disease the patient is facing. Caregiving services such as transportation, meal delivery, or housekeeping may be available. Join a support group. A support group can provide validation and encouragement as well as problem solving strategies for difficult situations. People in support groups understand what you may be going through. A support group can also be a good place to create meaningful friendships. Seek social support. Make an effort to stay well connected with family and friends who can offer non judgmental emotional support. Set aside time each week for connecting, even if it's just a walk with a friend. And most importantly, set personal health goals. For example, tell them to set goals to establish a good sleeping routine, find time to be physically active on most days of the week, eat a healthy diet, and drink plenty of water. Thank you for watching. You can also find this video on our YouTube channel.